Hello and welcome to Business Insider with Mario Toneguzzi on MegaPixx Media. Joining me today is Paula Allen, Global Leader, Research and Total Wellbeing for Morneau Shepell. Thanks for joining us today, Paula.
A pleasure.
Well, you guys released today your latest mental health index. Again, continued decline in the mental health and well-being of Canadians. Can you talk a little bit about that and what your poll results showed and what that means right now?
Yeah. Well, it is unfortunately that we see this continued compromise in our mental health, but it's not surprising. I mean, we're certainly not past our crisis in terms of pandemic yet. We have a lot of optimism in terms of vaccines and things moving forward, but we are still very tired. It's not the way it was. Some of us have even changed our behaviors in an unfortunate and unhealthy way, which is also contributing to the decline.
Now, I want to talk a little bit about depression and the long-term impact that has. We're seeing increasingly more people being depressed. What's the impact of having depression for a longer period of time, like we're starting to see now, I guess?
Yeah, that's a great question. Like any health issue, when we're talking about mental health, we're talking about a health issue. When you experience a problem and you deal with it and you move on, dealing with it is a lot easier. When you experience any health issue, and in particular a mental health issue, and in particular depression, it's much more difficult to get out of it. Your brain actually becomes accommodated to the experience of depression. It is harder for you to actually benefit from therapy. Not impossible, but that's why we always are promoting people getting help at the earliest possible moment, because the longer you experience these symptoms, the more difficult it is to get to the other side.
Yeah. Now, one of the interesting aspects of the survey was I guess the fact that mental health still is a bit of a taboo subject for a lot of people, right? So yeah, you're kind of ashamed, maybe embarrassed that you have it on the personal level, but also professionally, right? It's probably not something that a lot of people want to share with their employers, right? How much of an obstacle is that in getting us moving forward and beyond where we are right now?
Oh, it's a multifaceted problem. I mean, it's when you have an experience of stigma, when you feel that you will be stigmatized, when you internalize negative impressions of yourself if you had a mental health issue. Studies have been clear that actually prevents people from getting care. So just what we were talking about before, delaying care, it's a factor in that. So it actually makes your situation worse from that point of view. It also makes your situation worse because there is a burden that's on you. When you feel that you can't be yourself, that you can't express what's going on with you, when you fear negative consequences and have that on top of feeling the symptoms and the compromise as a result of having a mental health concern, it's a double whammy. So in all respects, stigma is damaging. Now, the good news is we've been tracking this over about 8 years now, and there has been some improvement in people feeling stigma as a result of being in the workplace and compromises that could possibly occur in their professional career. And there has been improvement in people's experience of social stigma, but it is still very strong.
Yeah.
And that is something that we have a lot of work to do on.
Yeah, exactly. You alluded to this earlier, but people, with mental health problems these days, especially in this past year, are making unhealthy choices in terms of coping with it. Can you talk a little bit about that, Paula, and what people are doing and the dangers of that?
Yeah, we've seen a number of unhealthy behaviors. So one is, with this whole pandemic has made it more difficult for us to connect with one another. But it is important that we find a way to connect with one another. And when we don't, obviously the isolation is more significant. We've seen increases in eating disorders. So, people having, unhealthy eating behaviors of all types. We focused very specifically this month on alcohol. And we have found that there has been an increase in the use of alcohol, and quite a significant increase in unhealthy use of alcohol. So having a couple of drinks every day, every single day, really might seem innocuous, but it gets you into a very difficult place. So that is one of the things that will have long-term consequences if we don't, deal with it in the short term, because your body and your brain doesn't give you any kind of pass because you're drinking more as a result of the pandemic.
Yeah. And one last thing, Paula, as all these employers see the consequences in terms of mental health that COVID is doing, what can organizations and companies and businesses do to help, I guess, their employees?
It's a great question. And one of the good news stories we've seen throughout is organizations who do focus on supporting the mental health of their people actually reap the benefits. Their people are doing better. And a few of the simple but very effective ways is really just to have that empathetic conversation. We've had, all employee calls with CEOs and experts and others, just really speaking about the fact that this is difficult from a mental health point of view, which helps people feel less alone in what they're experiencing, and also encourages people to get the help that they need if they need help. Reminding people of resources that are available, such as employee assistance programs, which many organizations have. And if an organization doesn't have an employee assistance program, in Ontario and Manitoba and some other jurisdictions, we have a program called My ICBT that is actually government funded. It is an internet-based cognitive behavioral therapy program that employers can tell their people about. And the last thing I would just say is be human. It is a difficult time. It's a time with a fair bit of anxiety, a time with a fair bit of upheaval. And when organizations, and in particular managers, are empathetic, are flexible to the extent that they can be, listen to what's going on in terms of the new stressors that people are experiencing at work, it really makes a difference.
Yeah, super then. All right. Well, thanks, Paula, for joining us today.
It's a pleasure.
Okay, that was Paula Allen, who is Global Leader, Research and Total Wellbeing for Morneau Shepell. This has been Business Insider with Mario Toneguzzi on MegaPixx Media. Thanks for joining us today.